Welcome to this edition of AFMC.
I'll tell you how I got better. I'm
glad to be here.
A mission to
Delivery of. Well, I think that we're going to talk about everybody's.
Arkansas is the second highest prescriber.
Welcome to AFMC TV. I'm Robin Ledbetter. Thank you for joining us. Today I have with me Dr. Chad Rodgers. He's the Chief Medical Officer for AFMC and also a pediatrician. Dr. Rodgers, thanks for being here today.
Thanks for having me.
So we're talking about RSV. Is it RSV season?
It is definitely RSV season. This is the time of the year, kind of late fall, winter, early spring, where we'll see RSV becoming more and more common. It's very highly contagious and so easily spreadable, and very probably the thing that most strikes the fear of most parents' heart, especially those parents of daycare age.
And so it's a respiratory illness. It's more than just a cold, though, right?
Right. So RSV is respiratory syncytial virus, and so it's a fairly common cold. It's seen here in Arkansas, usually kind of anywhere between October to late March, sometimes as late as early April. But it is, for most people, it's kind of a mild cold symptom. So runny nose, cough, and sometimes you get some fever, headache, some aches and chills. So it's fairly common. But for some people, especially very young babies, and also for elderly with health problems, it can be a pretty significant illness. For most people, they're going to get kind of a mild cold, and I think the most characteristic thing for RSV for most people is it's just kind of like this very annoying cold. Like, it's just your nose runs like crazy. The cough is very annoying and kind of comes in little episodes, and it can last for weeks. So the cold, more than anything, just is a very bothersome thing, but it is very contagious and very easy to spread.
And this affects all age groups. It's not just children, or is it more prevalent in children?
Right. We used to think of RSV as more of a pediatric illness. And so even when I was training in residency 25 years ago, we pretty much treated RSV as a childhood illness. But now, as we begin testing adults more and more, especially when they come in to the emergency room or to the hospital with bad respiratory illness, we began testing, and we began seeing that it was also causing a lot of disease in older adults, especially those with lung disease like COPD or heart disease, perhaps those people with also with diabetes or kidney and liver disease. So we begin to understand it had a lot of significance for adults as well. So as a result, there's been a lot of new kind of preventive vaccines developed, and also for adults, but also for children and for pregnant women.
And you mentioned some new ways to treat it. So that's really been a big change in recent years.
Well, so treatment has pretty much remained the same, but prevention has really been the area where it's grown the most. When I talk about prevention, we're talking about vaccination. So a lot of times the treatment for RSV, if you used to get sick enough to go in the hospital, is we're going to give you some oxygen and probably give you some fluids to keep you hydrated. If you have really bad disease, you may end up on a ventilator. But the big area to address RSV is really in prevention now. And so there's been a lot of effective vaccinations that have come on the market. And so you may still get RSV, but because of the vaccination, your likelihood for getting hospitalized goes down dramatically, and your risk for ending up in the ICU on a ventilator goes down very dramatically. So we have seen at least one good respiratory season last year where we began to get RSV vaccination in children. And it really significantly reduced the burden of the disease for kids, keeping them out of the hospital and also keeping them out of the ICU, which is really sort of the goal of vaccination.
Is that a vaccination that is a part of the calendar as to when they're young? Like what is the age area as to when that vaccination is administered?
Right. So we're really trying to target those very young children. So at the beginning of the RSV season, for those children that are less than 8 months of age, we can give the vaccination as early as a week of age. And so that's the window where we really try to target. So trying to get those, it's actually the unique thing about the vaccination for children is actually monoclonal antibody, which may not mean much to you, but it gives them some immunity that can last a good 5 months or so. We also have a really good vaccination that's more of kind of the traditional vaccination that we have done for other viruses that we are giving to pregnant moms. So those moms kind of in the very last part other pregnancy right before they deliver, ideally kind of about 5 weeks before they deliver, so that they produce an antibody to RSV that they then pass along to their infant and will provide good protection to that baby in the first year of life.
So that's something OBs, PCPs all really need to be aware of, that this should be given or could be given during pregnancy.
Yeah, and you've seen a pretty good uptake with patients who want the RSV vaccine, especially parents who've had at least one child because they've experienced just the whole illness of RSV. There's nothing more miserable than seeing your child be miserable and then you get the cold and become miserable. But so you see a lot of people beginning to ask their OB-GYNs during pregnancy about getting the vaccine and when they should get it during their pregnancy. But we also have a lot of parents coming into the office, especially right after those first couple of visits, really want to know how they can protect their kids from the RSV season and getting that RSV shot for the young children to kind of, we kind of have the routine vaccine schedule where we kind of give things at 2, 4, and 6 months. This can be given as early as a week of age, and really want to try to get them before 8 months. So there's really, so there's not like a lost opportunity to get it. So if you went and saw your doctor with your child at the 2-month visit, but they're now 3 months old or they're 5 months old, you can still get the vaccine. It won't mess up a schedule per se.
So what should parents look for to where they, aside from getting the vaccination, they think that their kid has RSV? What are the symptoms that they should know that they need to take their child to the doctor?
Right. So for the most part, RSV is going to be like other viruses. You're going to get a cold, you're going to get a runny nose, you're going to feel bad, you're not going to want to eat or drink as well. But because of the amount of mucus it produces and the amount of inflammation that it can cause in the lung, it can really cause a lot of trouble with feeding. So, if your child is not drinking well because they're just so congested and they're worried about them getting dehydrated, and hydration is really one of the key factors to kind of dealing with RSV. The other thing is a baby who can't breathe well is not going to want to drink well. So if they're beginning to have more trouble breathing, you see their airway is starting to kind of do the little tug. They're using their chest is rising and they're kind of working much harder breathing. That could be a representation that they're getting the infection in their lungs. Possibly what we most commonly see is wheezing triggered by the virus in those kids. So, if your child is not drinking well, is not feeding well, is really working hard to breathe, it's probably time to reach out to the pediatrician or your pediatric care provider. The other thing is if sometimes, you get fever for 2 or 3 days and you do the Tylenol and the Motrin for an older child and you're kind of keep them hydrated, but if they keep having fever beyond that 4 or 5 days and they just don't seem to be improving, RSV can often lead to other things like ear infections and pneumonias. So, if they're not kind of following that kind of common route of just a routine viral illness of, some cold symptoms and fever for 2 or 3 days, but keeping on, then that might be another reason they would want to reach out and talk to their pediatric provider.
And what are some ways to prevent it?
So now we have the vaccine, which we've talked about quite a bit, but good hand washing is really important. This likes to live on hard surfaces for sometimes several hours, but we sneeze and we cough on our hands, we touch doorknobs, we cough or sneeze into the air. So good hand washing and also kind of covering our mouth when we sneeze or cough. Masking would also be a good option if someone is at home and has the virus and you're trying to kind of prevent the spread, or even if for some reason you have to go into public, we'd probably encourage you to stay at home for the most part if you're sick. The other thing is for RSV is there's also vaccinations for older adults now. So for those older than 75, they can get a vaccination that will protect them from getting sick with RSV virus. But for those adults that are 60 and older that may have diabetes or may have like a COPD from smoking or heart disease, they will want to talk to their doctor about getting the vaccination as well. So if we can control the spread in adults, we may also be able to control the spread in children and vice versa. I think the other thing is trying to really avoid sort of respiratory irritants, smoke being the biggest one. But anytime we get a big change from cold to hot and hot to cold, that can kind of stir up things in the air. kick up a lot of irritants into the air. So those are things that can kind of sometimes make the symptoms worse.
Well, Dr. Rodgers, thank you for talking about this important information. I appreciate you being here today.
Oh, thanks for having me, and look forward to seeing you next time.
And that's it for AFMC TV. Have a great day, and thanks for watching.